Teaching and learning remotely during this pandemic is hard work, but it is also helping to keep communities, schools, and families safe. Yet during this time of rising COVID rates in our nation and in our community, our school district is intent on reopening our doors when GUSD is not prepared to do so in a safe manner. So, why is Glendale Unified not ready to open its schools for in person instruction? First of all, COVID rates are not decreasing. They are increasing nationally and locally, and the situation is not improving in Glendale. In fact, Glendale's rate of new cases exceeds Los Angeles County's case rate. Los Angeles County is one of just 9 counties in the state in the purple tier, which means COVID transmission and infection is considered widespread. With the holidays ahead of us and Glendale showing an upward climb, opening up schools with these metrics is not in the best interests of the overall health of our community. A second reason why GUSD is not ready to open its doors yet is that while GUSD says it meets or exceeds all county health requirements for reopening schools for our highest need students and for our teachers, our survey results and the district's own data show otherwise. First, let's talk about windows. LA County health officials say that doors and windows should be kept open during the school day if feasible and if outdoor conditions make this appropriate. More than half of Glendale teachers report that they are unable to open and close their windows, or they do not have windows at all. Classrooms are contained, indoor spaces where children spend multiple hours. We have raised this concern, and in spite of the prevailing health guidance, GUSD has said that they do not intend to upgrade or repair windows in order to provide fresh air in classrooms. So the windows don't work. That must mean our HVAC systems and ventilation are top notch. County health guidance states that HVAC systems shall be in good working order, yet GUSD's most recent HVAC service reports indicate that even with few people on campuses, HVAC systems are not working well. Between August 17th and October 6th, there were 87 service calls from 21 school sites. We shudder to imagine how that number will increase when even more students are on campus. And even before entering these GUSD buildings, teachers have not been consistently screened for COVID symptoms. The county requires employers to conduct employee health screenings before employees may enter the workspace. Yet the GTA survey of its members reveals that 12% of our members who have been voluntarily reporting to school sites have never been asked health screening questions. Another 14% have said they have completed paper forms that they have never been asked to submit to a supervisor. Our schools are not ready to reopen when some schools that have been open for months now have not been following established protocols for health screening and have possibly been allowing people with COVID symptoms onto campus. Finally, let's talk about what can be done and suggest that while GUSD has not expressed interest in instituting certain practices that can lessen risk on our campuses, doing so would surely increase trust in our district leadership. First of all, let's talk about creating work and learning spaces outdoors. We all know that we are safer outdoors, and the LA County Department of Public Health has strongly encouraged the use of outdoor space for at least 50% of the school day. Schools across the nation have done this, and they've done it without breaking the bank. Let's explore that possibility, not just for our high need students, but for all students. Give school sites the task of creating plans for how they would use their campuses' outdoor areas. We have lots of creativity in our collective body in GUSD. No one group has all the answers. Second, let's explore how to address the issue of inoperable windows. Dismissing the possibility of fixing something that can serve the health of our children and adults in schools is not good public policy. Finally, let's talk about surveillance testing for COVID, a widely recommended technique employed by many other school districts, but not yet endorsed by our school district. Such testing will help identify some, though not all, asymptomatic cases, individuals who would not otherwise know that they were infected, but who could, as a result of testing, quarantine and avoid spreading COVID to others. The data from these tests will also help parents make informed decisions about the likelihood of their child being exposed to COVID-19 by an asymptomatic person when entering GUSD campuses. Glendale teachers understand the pressing need of getting children, those who are high need and those who have few special needs, back on school campuses. However, our greatest need is to have a constructive dialogue on how to make that happen and what public health conditions make these plans feasible. We're not there yet. both because of the health data and due to the rhetoric from school district officials who forget that when they vilify the teachers union, they vilify the very educators who teach our district's 26,000 students. The GTA, as the representative of the more than 1,250 educators in Glendale, wants to collaboratively work with GUSD to help return our teachers and students to safe classrooms when health conditions permit. We have ideas on how we can do that. We're ready to have that conversation.